This drill is going to go over the positioning of your pelvis in regards to when you're going to do some type of lift or exercise. The way that your pelvis is positioned directly impacts how your hips are going to function and how your lower back is going to function, as well as areas even above and further below that area. So one drill that I give to patients to try and recognize the position is this little tip of the pelvis forward and back. Now, if you look at me from the side, and I'll show it from the front as well, I take my hands right on the top of my pelvic bone, my iliac crest, and I want to try and move my pelvis without moving my shoulders. So most people that have stiffness or a lack of control here, they'll do this and they'll do this, moving more from the shoulders, and the pelvis doesn't move much at all. So I definitely recommend you do this in front of a mirror at first to get the idea. So hands on my pelvis, I want to try and tip it forward as far as I can, taking the front aspect of my pelvis down towards the floor. You see it also puts a sway or a big arch in my back. And then I tip it backward, flattening my lower back, kind of tucking my butt underneath me. So the other terms used, this would be an anterior pelvic tilt or forward tilt of the pelvis. This would be a posterior pelvic tilt or tipping backward of the pelvis. Now between the two, usually I want people to be a little bit more on the posterior tilt side. That doesn't mean I want them to go to the extreme of really rounding and flexing their back. In general, we're trying to flatten the low back and keep it neutral. That anterior tilt tends to be something that's common with a lot of people that have tightness in the front of their hips or tightness in the muscles in their back. So I want to diminish that some by bringing the butt underneath me a little bit to more of this flat back position. So not going necessarily to the extreme, but going more to that neutral. Now that's where you want to try and build some awareness, because a lot of the movements that I'm going to teach are going to be based off of first achieving that. So just seeing it from the front, same idea. I want you to really pay close attention that I don't move my shoulders very much, right? So I'm trying to move just at the pelvis without this, or a very common one is this rounding of the shoulders, because we'll do that to work around the lack of control in this area. So I would start off in a mirror, try to do that maybe 10 to 20 times, and really trying to get some awareness of what that slight posterior pelvic tilt of the butt tucked underneath me feels like, because that's what I'm going to use with a lot of positions. For instance, if I go from here and I want to lift something from the ground, you have a lot of people that go like this, right? Or they're scared to bend at their backs, so maybe they bend at their knees. Ideally, I want to try and keep that pelvic position. So even as I go down to lift, you see that my lower back is not moving, it's from my hips. So that's just one functional application that we'll use that for.